Good evening, everyone. First, I want to thank each of you for joining us here today on our conversation to knock out opioid abuse here in Robbinsville. Tonight's event is being hosted by the Partnership for a Drug-Free New Jersey and Horizon Blue Cross Blue Shield of New Jersey. My name is Angelo Valente. I'm the Executive Director of the Partnership for a Drug-Free New Jersey, and I'll be your moderator this evening. We want to thank you for your commitment to be part of the solution to the statewide opiate epidemic. The Partnership and Horizon, through its philanthropic arm, the Horizon Foundation for New Jersey, have earmarked a new 2-year Knock Out Opioid Abuse initiative to address the opiate epidemic throughout community outreach, prescriber education, parent education, and a statewide awareness campaign. This is the first of 21 knockout opioid abuses, one in each county, that will be held throughout 2019 and 2020 to help address the opiate epidemic and to develop solutions to this epidemic at the community level. And this is particularly important because this week is also Local Government Week as part of the New Jersey League of Municipalities initiative to engage local government. So we are doing exactly that tonight. New Jersey, unfortunately, like the rest of the country, is in the midst of an opiate epidemic. There's not a day that goes by without hearing or seeing a story in our neighborhoods or in the media about the impact of the misuse of prescription medication, heroin abuse, the countless overdoses impacting all of our communities, and so many families dealing with this epidemic on a day-to-day basis, the challenges, the crisis, and the disease of addiction. Robbinsville is not immune. No family, no community is immune. And today we gather to learn how communities can address the epidemic, to learn how we can prevent more New Jersey residents from becoming addicted, to learn how we can reduce the stigma of addiction, to learn how we can help those who are addicted, how we can support those in recovery, and most importantly, how we can bring awareness to this crisis and avoid other families from going through this particular crisis that we're dealing with throughout the country. The Partnership and Horizon are pleased to bring this conversation to Robbinsville this evening, along with our collaborators, the Robbinsville Community Addiction Recovery Effort, CARE, the Community Robbinsville Township, the Mercer County Prosecutor's Office, and the Prevention Council of Mercer County. We thank all of them and all of those, our resource tables in the back, for being here supporting this initiative. And I want to especially thank Jody Stevens, who helped us organize tonight, and for all of her efforts. Let's give them all a round of applause. There are no easy answers for solving the opiate epidemic, but there are ways that each of us can make a difference in this important fight. It is necessary for everyone, parents, community leaders, students, and residents, to work together as a community and develop ways to end the epidemic and change the public attitude towards addiction. This town hall and other efforts are here to educate and empower all of us, the residents of Robbinsville and the residents of every community in New Jersey, on taking those important steps towards change, which will ultimately reduce the opiate epidemic in Robbinsville and Mercer County and throughout the state. Thank you for joining us here today to start the conversation. It's now my pleasure to introduce our sponsor for today's town hall, the Horizon Blue Cross Blue Shield of New Jersey, represented tonight by the Dental Director, Government Programs at Horizon New Jersey Health, Dr. Fred Diorio.
Good evening. It's my honor and my pleasure to be here this evening to speak on behalf of Horizon and to welcome you to this very important town hall on the response to the opioid epidemic. Thank you, Angelo, for your introduction and leadership, and thank all of you for your interest and attendance in coming here tonight. As the state's largest and most experienced health insurer, Horizon Blue Cross and Blue Shield of New Jersey is dedicated to improving the lives of all New Jersey residents. That is why we are proud to work with the Partnership for a Drug-Free New Jersey to bring you tonight's town hall as part of the Knock Out Opioid Abuse Town Hall series that is taking place in communities throughout the state through 2020. The collaboration is part of our company-wide focus to use all the resources at our disposal to help end this public crisis in the towns in which we live and work. The Town Hall series and many other efforts are being funded through the Horizon Foundation for New Jersey, the philanthropic arm of the company. The grant to the partnership represents a large portion of the $1.3 million the Horizon Foundation has awarded in grants since 2016 to help educate New Jersey residents about the seriousness of the opioid epidemic and what is being done to help address substance use disorder. The issue impacts every community in New Jersey, with more than 3,100 drug-related deaths in New Jersey in 2018 alone. It's clear that more needs to be done. Prior to my current role at Horizon, I practiced dentistry in New Jersey, Northern Jersey, for over 30 years. I also served as a dentist in the Army Reserves for 28 years. When I began practicing dentistry, it was common practice to prescribe an opioid. Tylenol with codeine was probably the standard of care when you had a root canal started or a wisdom tooth extracted. But through the years, my habits in prescribing changed. I went from prescribing opioids to having in my office ibuprofen or Advil or Motrin, they're all the same thing, have like 800 or 600 milligram bottle in my office, and I would give patients 6 or 8 pills and just tell them to take 1 3 times a day. Years after that, after doing research and reading, I found that a mixture of like 2 Advil with 1 Tylenol was working just as effective for pain relief as many of the opioids that are prescribed. So I changed my habits and practice to moving away from prescribing opioids to using over-the-counter medications, and it was very successful. I'm also a state-certified EMT, and I volunteer with the Manasquan First Aid Squad. So I ride every Wednesday night, and I go on calls during the week when I'm home. And it's all too often that, you know, I've been the first responder on an unresponsive patient with a drug overdose and had to administer Narcan. And it's very sad to go back a week or a few days later, sometimes even, and administer that same person Narcan again. And it happens way too often. It's very evident that we need more people to be part of the solution. Through our collaboration with the partnership and other state and local nonprofit agencies, we are committed to using the Knock Out Opioid Abuse campaign to combat the opioid epidemic through community outreach, prescriber education, parent education, and a statewide awareness campaign. Tonight we'll hear about the impact of opioid epidemic in your community and the steps being taken to address the crisis. In closing, I want to thank the Robbinsville Senior Center for hosting us and Robbinsville Township and Mercer Council for collaborating with us to present this town hall. I also want to thank our distinguished guests and the panel of experts for their participation. Together, we can make a difference in combating this epidemic that is destroying lives. Thank you.
Thank you, Doctor. Before we begin, I just want to also mention that tonight's event is being live streamed. There are folks that are watching this in Robbinsville and throughout the state to be able to gain information, those who could not be here this evening. Today's town hall is learning from experts, our expert panelists that we've gathered, as well as you, members of the community. We want to share the issues affecting all of you. We want to know what's working in our community here in Robbinsville and what's not. We want to question and come up with recommendations. We want to share. But first, we're here to get some brief introductory comments from our expert panelists. I'm going to ask each of them to please join us. First, we have Dr. Neil Schofield, who's the chairman of the Department of Psychiatry, Penn Medicine, Princeton House Behavioral Health. Dr. Schofield. Our next panelist is no stranger to the residents of Robbinsville. He is our mayor. Let's welcome Mayor David Freed. Next, we have with us the CEO of Legacy Treatment Center, Roy Lightstein. Roy? Our next panelist represents a very important segment of our communities that need to be engaged and involved and have been a big resource. And he's representing our religious community, the Reverend Edgar Schaefer from the Robbinsville First Baptist Church. Next, we have Maritza Esposito, who's here for In Recovery Robbinsville Care Program. And our last speaker, who will be joining us in a few moments, he's dealing with some issues in the office, is our Mercer County prosecutor, Angelo Onofrio. When he joins us, we'll ask him to join us right on our stage at this point. So we'll ask each of you to take a seat. We're going to begin with Dr. Schofield. We will start with understanding the public health perspective of the opiate crisis. How is the medical community addressing the public health aspects of the opiate epidemic? Doctor?
Well, I think first of all that we're facing an entirely new entity as medical professionals. A lot of I've been doing this for a number of years, and when I started out in addiction treatment, the big problem was alcohol. And it's still a problem, but it's very different than opiates. And treating opiate abuse is really multifaceted. It involves a lot of education. It involves re-educating the professional community. I think it was alluded to that prescribing practices have changed over the years. We're much more sensitive now to treating chronic pain. Because the opioid epidemic, actually the opioid epidemic or crisis, what do you want to call it, actually is 3 epidemics. It actually is in 3 parts. The first part was the proliferation in the late 1990s of the use of opiates for pain in a very general sense. It was very liberalized. And again, there are some instances where that's very legitimate, but what happened was that the use of opiates was oversold to populations who shouldn't have had it chronically. That created the first wave. The second wave in the early part of the 21st century was a lot of the folks who had been on those medications lost control of them, lost the ability to pay for them, and went to heroin. The third wave, which is more recent, actually is the deadliest wave of it, is the rise of the synthetic opioids. And that is really what we're dealing with now in the population. That's where we're seeing a lot of the overdose treatment that we have to do with Narcan. We, for example, will very routinely give out Narcan to patients and to their families, and we usually give them a 2-pack deliberately because the synthetic opiates are that much more potent than the regular opiates. There is a physician monitoring program in this state, which is very robust. And as a routine practice, the inpatient physicians in my facility will look up every patient that comes in. We try to track down what's going on, educate the providers, educate the patients, educate the families. Some of the people have been using these drugs for a long time. They don't realize what they're doing until they get into trouble with them. So it really is a learning process. But I think the biggest thing really is to recognize the fact that addiction is a brain disease. And what happens when someone is habituated to opioids is that their reward center of their brain is hijacked. And the way the brain works, you sort of have a thinking part on top and a reward center sort of behind your eyes. And that's been around longer from evolution. That's been around a lot longer than the cortex. And what happens is that when that gets stimulated and conditioned by opiates, it's very, very, very difficult when someone tries to get off. And what we've done, we've used medication-assisted therapy where we've given people long-acting opiates to help them to transition off of them. If in some cases they can't do it, we're giving them long-acting opiates as harm reduction so they don't go back to heroin. Naltrexone, which is an opiate blocker. We have medications now. What we don't have is enough dissemination of knowledge. And we don't have enough dissemination of knowledge in the professional community. I can tell you, I run an inpatient unit. And routinely, we get people coming into the inpatient unit, and they don't really even realize what they're on. But a lot of them are on multiple addicting medications for years, and they don't know. So part of our process is we have to tell them, and I can tell you sometimes they're not appreciating that message because they've been taking something that was prescribed by a doctor that's killing them. So that's a very difficult conversation. The families also need to be educated because it's a very difficult thing dealing with this from a family perspective. Not only is addiction a brain disease, but it's also a family disease because the addicted person ricochets off many people, whether it's a spouse, whether it's somebody they hit with a car, whether it's a child. And those people are hurt, and they're not under the influence of drugs, so they remember it, and they're damaged by it. So it's something that we work with the families, we work with the patients, we try to educate people. But I think one of the things that's very significant about this meeting tonight is that you're all here. Because the reality of it is there are only a couple of thousand addiction specialists in the country. So if all the addiction specialists got together, they can't make that much of a dent in a population of 270 million people. They need the families, they need the people who are in support, they need the law enforcement community. So I think that's really where we're trying to come. I will say that I think there has been a sea change in at least some parts of the community relative to prescribing practices, and at least the recognition to seek consultation from an expert, which is a really good thing. And I'm really pleased that this initiative is occurring for that purpose.
Thank you, Dr. Schofield. About 2 years ago, the state of New Jersey implemented a comprehensive law that spoke about or pointed in the same direction that the doctor just spoke about. And it was called A3S3, and it was signed into law in February of 2017. And what it does, what the law now provides in the state is that first, those who prescribe have to have at least 1 hour each year that they renew their license of a CME, continuing medical education credit, on safe prescribing. And the partnership and Horizon will be providing that online. In several weeks, it's going to be live for all of the physicians and dentists and nurse practitioners and others who prescribe. The second part of that law was it limited the supply to a 5-day supply for first prescriptions. And the doctor mentioned how important it is that we look at alternatives and we also look at the prescribing of opiates. The third part, which we're most proud of, is something that we helped author. It's called the patient notification law. And what that does is it requires that prior to prescribing an opiate, a prescriber, whether it be a doctor or a dentist, has to have a conversation with the patient or the parents of patients 18 and under and share with them the addictive quality of the drug that they're being prescribed and also any non-opiate alternatives. Now, New Jersey was the first state in the nation to implement that law. Over the last year and a half, over 10 states have adopted our law that we created here in New Jersey, and there are 8 other states currently that hopefully by the end of June will adopt this notification law. So as a doctor mentioned, we also, Horizon and the partnership, believe so strongly that education is going to be the way that we're going to be able to address this epidemic. So thank you, doctor, for those encouraging words. Over the last 2 years, we traveled throughout the state and we focused on the county. We focused on the 21 counties in New Jersey. Over the next 2 years, we're going to be focusing on one individual community. So this question is to the mayor. Can you talk about the role of local government in addressing this crisis and what resources are available to residents?
All right. Well, I think I could talk a little bit about some of the things that we've done in our community. And probably the #1 thing that we did in our community is the CARE program. It was actually born here in Robbinsville. And when you think about a program like this, when you think about politics today, politics have become, pretty toxic. And the reason that it's become a little bit toxic is because it's difficult for people to listen. It's a lot easier in politics for us to criticize, for us to talk about what doesn't work, for us to talk about things that maybe aren't the way that they should be. What's hard is listening and compromise, and that sometimes has been lost. And when the CARE program started, it truly was an act of compromise. And, incredibly surprising to me when it happened. First, my police department came to me and told me about an idea that we're going to bring people into treatment and we're going to actually not arrest them, but we're going to put them into programs. And I kind of listened for a little while, and then I listened to the prosecutor's office talk about the fact that they're on board and they don't want to prosecute. So let me get this straight. My police department isn't going to arrest people, and my prosecutor's office isn't going to prosecute? They're like, yes. So once I got through that part, I said, okay, all right, now tell me a little bit more. And then we had recovery advocates, and we had the City of Angels come in, and again, listening to how this is going to work. And this took an act of everyone really stepping outside their normal box and listening to one another in a way that, frankly, I never saw happen before. And when we think about, the fear of failure, I always tell people all the time, if you're afraid of failing or if you haven't failed, your idea wasn't big enough, right? Your goal wasn't big enough. This was a huge goal. This was going to be a change in the way that everyone was talking to and working together. And our police department is working with the City of Angels and recovery advocates. Recovery advocates, this is a group that literally every night never, ever, ever say no. They are there. They never say they're tired. They never say we can't. They never say they're not going to be there. They're busy. They're always there. They always say yes, and they're meeting with people, and they're talking to people who've been arrested and trying to talk them into, instead of going to jail, instead of going to be prosecuted, to get into treatment. And this was a sea change for us in the way that we're doing things. Today, when we think about the CARE program, it's now in every single town in Mercer County, which is truly unbelievable, and it's had a 60% success rate. And just in our little town, we've had 80 people go through the CARE program successfully, 80 lives that have been changed. We've changed the way that we're doing things, and it's a true credit to our police department who really decided to think outside the box. I wish our Mercer County prosecutor was here, because his leadership from Angelo Onofre to be willing to change the way that we're treating people is incredible, because we knew we weren't going to arrest our way out of this problem. The only way it was going to work is if we started getting people help, and we got serious about getting people help. And we started talking about it openly. And it's something that I'm very, very proud of. And again, with working together, listening, compromising, it's how the CARE program came about. It's how we're dealing with things in Robbinsville. It's why I think we're doing things so differently. And it's something that I'm very, very proud of. If you think about it today, 80 lives that have been changed. And we have groups coming together and working together. We have people like Roy Leichstein, who's with us, who are willing to open programs in our town. Our pastors are working with us. So, I think all of us working together is the only way that we're going to win. This isn't going to ever happen on an island. It isn't going to happen in the dark. It isn't going to happen about not talking about it. There is no families that haven't been touched. There's no people that haven't been touched. And the more we bring it into the light, the more we drag it out into the open, the more we're willing to listen to one another, that's how we're going to win. That's how government's going to win. We're not going to legislate our way into this. We are going to drag everyone into a big tent, and we're going to figure out the solutions. And people tell me all the time, oh, you started the CARE program. All I really did is listen to a bunch of unique ideas that started at our police department and worked its way forward. And I couldn't believe that everyone was willing to compromise. And that's what made it so successful.
Thank you, Mayor. The mayor mentioned law enforcement. We in New Jersey are very fortunate, because at every level of law enforcement, we've found that they have been very supportive, cooperative, and innovative in addressing the opiate epidemic. And on May 30th, the partnership will be hosting a statewide conference for law enforcement on sharing ideas, looking at best practices, and being able to share what's working at the local community and how we could bring those programs like the mayor has and the prosecutor and the local police department have brought their program to other communities. So thank you for your all the information you provided here to us today. Roy, next question. What types of barriers exist when someone is seeking treatment, and what could they do to get help?
Sure. Easy question, no problem. First, how about a round of applause for our law enforcement in the back room, yes. Robbinsville Police Department, and our mayor up here, Dave Freed. It's only with that joint effort that we see any progress to eliminating barriers. One of the keys to defeating the barriers to battling the opioid epidemic is admitting that it's not a choice disease, right? And so Dr. Schofield pointed this out and said it in a way more intelligent way than I'm going to, but the makeup of the brain changes. Somehow we, as a society, believe that if we define addiction as choice, then we can then blame addicts for the choices that they've made, and that will absolve us of having to help anybody. But anybody who's got a loved one, and everybody's got a loved one, right? Everybody has a loved one, a friend, a family member, somebody. I lost my father to addiction. He spent 20 years on opioids as a shut-in, right? So, and everybody's got that story. And what we have to understand is it's not choice. It doesn't matter. Somehow in the idea of treatment and the idea of getting folks to help, we misperceive this notion that if we get them help, they're not accountable for their actions. Nowhere in there, when we say that addiction is a disease, do we absolve the addict of their actions, right? We differentiate those from the fact that we just have to get people help. And by the way, if we don't get them help, this morning I was at an event with Governor McGreevey and the reentry program, the New Jersey reentry program, where you're going to pay the price on the back end. Yeah, that's right. That's exactly right. I'm used to that sort of thing happening. So the reality, so how do we break some of these barriers, right? And first and foremost, the idea is education, right? Addiction doesn't know any socioeconomic standard. It doesn't know race. It doesn't know creed. It doesn't care where you live. It happens, right? Anybody who's got an adolescent, a teenager, the older population, they're increasing, right? So it's happening everywhere, and so we have to be aware of the signs and the signals that addiction is taking place. The other is we often see on reality TV these stories and they sort of get glorified, and we look and we go, man, I would never do that. How could I do that? The society and the family that surround folks, you're enabling them. How could that happen? That does not happen overnight. Like a moral compass degrades over time because we love the people that are addicted, right? And so what we have to understand is look for those signs, those changes in behavior. Call it like you see it, right? I have a 17-year-old kid. I go through his stuff. If his eyes are red, I'm like, why are your eyes red? I'm tired. I'm like, prove it, right? And not because there's some harsh consequence at the end, but because this is the reality that we live in. There are 80-year-olds that are addicted to opioids, and there are 15-year-olds that are addicted to opioids. We have to do some advocacy too. So while we talk about all of these treatment modalities that are out there, right? Medication-assisted treatment or medication-assisted therapy, there's 8 times more opioids than there are medication-assisted treatment options, right? And so what we need to do is we need to do some advocacy there so that we can see some of that progress so that the FDA doesn't block some of the new stuff that's out there. Here's something that's really cool about being in the state of New Jersey. There's something that's called a behavioral health carve-out, right? A behavioral health carve-out. So it means if you have no insurance whatsoever, you qualify for addiction treatment services. The only problem is it's not everywhere. The access to services, they don't exist everywhere because unfortunately the reimbursable rates, they're kind of tough for a provider. I know I run a nonprofit, Legacy Treatment Services, right? We're big. We see 16,000 people a year. We're in 16 counties. And I can tell you, I'm putting a detox, a residential detox, and residential inside of a hospital because I think that's when we'll know that we have stemmed the tide. When you can go to your primary care physician and you can say that you're addicted to opioids and they can help treat you, and when you have a Narcan reversal and you're brought to the ER and you can get immediately walked in to detox, right? And our recovery advocates have a place to bring you, and they're not begging and pleading all over the state or all over the country to some place like a beach house in Florida going, hey, can I get a bed from you? That's how we know we're going to stem this tide. I'm opening up that detox licensing application 18 months in. 18 months to open up a new detox because there's such a backlog. But here's the deal. There's NJ Reach, there's 211, there's your local law enforcement. Call. When somebody needs help, refrain from judging in that moment and just call. If 5 years ago I had gone to local law enforcement across this state and said to them, I want to equip you with a drug that would reverse an overdose, and I want everybody in your department to be trained on it, they would have laughed me out of the room. And now, that's standard fare. We're saving lives every day. We lose 70,000 people a year to opioid overdoses. 70,000 people a year, right? That's Eagle Stadium. A year. So what do we do to break that up? Here's what we do. We make sure that we pay attention to the people that we love, and we ask them questions. And when we think that there's a problem, we're not afraid to tackle that. We don't judge, because very rarely, think about that for a second, very rarely as an addict, when someone yells at you or criticizes you, is that going to help you move towards treatment, right? That's just not the way that it works. We're not absolving anybody of accountability. We're just surrounding them with some love and some caring to get them to the place that we want them to go. And the third is advocate. Bug your mayors, bug your legislators, call. When you see something like S3 come up, when you see advocacy, when you read a news article that says a drug that was designed for medication-assisted treatment to help pregnant women that is not allowed on the market for 2 more years because it's too competitive with something that's already out there, advocate for that. That's what I got.
Thank you, Roy. Our next question is for Reverend Schaefer. Reverend, what role can...
Sir.
No, what role can the faith-based community play in addressing the opiate epidemic?
Okay. When we first got up here, they said that there was a panel of experts. All the experts have nothing in their hands. I'm not an expert. But in the faith-based community, we can come together and network. That's what it's about. When we come together and we network and we reach out, it doesn't matter about what your religious belief is. If we come to this point, which I call CWA, compassion with action, we can meet at that level that all of us can share information. And what the experts up here were talking about was sharing information. As a faith-based community, we have the responsibility to open up our facilities for the help. There was something I wanted to read. And as a faith-based, I want to just first greet the faith-based community. I want to first say, Namaste. I would like to say, Assalamu alaikum. I would like to say, Shalom. I also like to say grace, peace, and blessings unto you. And for those of you I missed, hello, what's up, howdy. Pastor, did I get everybody? All right. CWA, compassion with action. See, I was reading this article by the Surgeon General, Jerome Adams, and he was talking about everywhere that he went, there was the epidemic was so severe. So he started to talk about, well, you know what? This opioid crisis is out of hand. But right now, all hands must be on deck. He's also said faith-based organizations and service providers are motivated by what we call service to our neighbors. See, it's going to take service from your neighborhood. See, what happens is long-term recovery is not dependent upon inpatient programs alone. Long-term recovery is not dependent on outpatient programs alone. Long-term recovery is not dependent on NA or AA alone. What long-term recovery is dependent upon is the individual and the community that he's surrounded by. So what do we need to do as a faith-based community? Be willing to open up our doors to allow and to also come together with other organizations and say, listen, we can't do this alone, but together we can. That's what the faith-based community should bring.
Thank you so much, Reverend. And we want to welcome our prosecutor who just joined us, Angelo Onofre. Angelo, thank you so much. The prosecutor and his office have been really true advocates of our programs, not only with this program, but for many years with all the programs that we have been hosting. So we appreciate their support. And Prosecutor, I'm going to ask you to please give us an overview of the opiate abuse epidemic here in Mercer County, and specifically in Robbinsville from a law enforcement perspective.
Sure. Whoa, that was loud. So Mercer holds a few distinctions. The first is that we are considered to be a source county for heroin. Not a distinction that we like to put in our travel brochures here for the county. On top of us being a source county, our heroin levels here in Mercer are between, according to the DEA, are between 68 to 72% pure, which is the highest in the United States. So the epidemic, according to the National Institute of Health, nationally, it's estimated that there's 1.5 million active heroin users in the United States. In 2018, or 17, I apologize, 72,000 people died of opiate overdoses in the United States. Here in New Jersey, and this is with every police department in New Jersey carrying the opioid antidote Narcan, 2,700 people died of overdose. On top of that, here in Mercer County, and all of our police departments do carry Narcan, 155 people lost their struggle. The numbers are real, and the deaths are real. If you don't think it's present here in Mercer County, last year, my office alone seized 48 pounds of heroin off the streets of Mercer County with a street value of about $3.2 million. But that's not the big problem. We're kind of dealing with the demand portion and the supply portion by taking that off the streets. But the reality is we face another problem here in Mercer, and that's the addition of the synthetic opioid fentanyl to heroin, now marijuana, and literally every other drug that you could think of. It's 80 to 100 times stronger than morphine. The DEA has a great photo that shows two little vials. And the vial that contains the fentanyl is about 5 to 7 salt-like grains that would produce a fatal overdose. Last year in Mercer County, we seized 6.6 pounds of pure fentanyl. 6.6 pounds. I'm not a big math person. I went to school in Hamilton, so math wasn't a big thing for me. But that translates roughly to 3,015 grams. And according, thanks, Mayor Freed. He was checking my math. But those 3,015 grams, according to the DEA, is enough to kill 1.5 million people. It's that strong, it's that potent, it's that deadly. See, and the reality is that it's big business. And the drug dealers do everything they can, not only here in Mercer, but in every other county throughout the state, to get you addicted to their brand. The packets of heroin that are about the size of a Splenda packet have stamps on them. Blue Camel, WMD, weapon of mass destruction. It's no different than you developing a loyalty to Diet Coke or Pepsi or some other kind of soft drink. The dealers want you to develop a loyalty and a taste for their brand, so that's where you always go back to. But the problem is that the dealers really need to keep you addicted. And by adding fentanyl to the heroin, does anybody old enough remember the old contact cold pills? Anybody remember them? You know, you take one and it knock you out. But once you woke up, you had that 12-hour prolonged time-released relief from your nasal congestion. And the reality is that fentanyl works a lot like that, and that's why the drug dealers are adding it to the heroin. And also now, the big trend throughout the state is marijuana. They want you to come back to that marijuana with the fentanyl in it, and they're charging higher prices for it. But when you mix that, assuming that you can get over not dying with the fentanyl, it produces a prolonged high. And if that person doesn't die from the ingestion of the fentanyl, you now have a customer that's very loyal. And you mentioned just about, you know, what's going on here. Well, Robbinsville is very active, thanks to Chief Nitti and Mayor Freed and my good friend Scott Kivett. They're very active in the interdiction. They make sure that you've got major roads going here through Robbinsville. And folks are going into Trenton and bringing it back down to the shore in mass quantities. So here in Robbinsville, there's seizures literally every day. Please don't think that just because this is a great community and that it's very affluent, that the problem's not here. Once you start thinking that, that's when you lose the battle. Because the reality becomes, with all of this, is that the minute we let our guard down, that's the minute the drug dealers win. It's the minute that they win. And I'll leave you with one final thought. In 2016, NewJersey.com did an article called Heroin Town. And Heroin Town estimated that there were 128,000 active heroin users in New Jersey. If all 128,000 of those active heroin users lived in one municipality, it would be the 4th largest municipality in the state of New Jersey. 4th largest. And who lives there? The youngest resident was 13 years old. And that person died of an overdose. They were from Cape May County. The oldest person was 79, who had developed an addiction to heroin after opioids were no longer being prescribed. The average person in Heroin Town is between 18 and 26 years old, and they're a white male. That's this community. That's this county. And the people that live in Heroin Town are doctors, lawyers, judges, soccer moms, soccer dads, coaches, teachers. Everyone can live in Heroin Town. And when you think about that it could impact any of us in our room. It could impact our neighbors. It could impact a family member. It really brings it close to home. And the reality becomes that thanks to programs like Mayor Freed has here in Hamilton with CARE and our friends from Recovery Advocates and City of Angels who are running the CARE program, they're doing God's work. And they are making sure that people get into treatment. Because I can assure you, we will never arrest or prosecute our way out of addiction.
Thank you. Thank you, Prosecutor. Thank you. Our next question is from Marissa. Marissa, could you tell us some of the barriers to recovery and also what role does stigma play in this epidemic?
Yes, thank you. Hi, I'm Marissa. I'm an addict. You know, when they talked about experts being here, I'm thinking I'm definitely not an expert, but I've lived through a lot of this. I'm speaking from the stigma that is attached to obviously people using, drugs, any drug of their choice. It's really hard for somebody to come forward and talk to, anybody about it because you're embarrassed, you're ashamed. I've had different stages of my life where I have been addicted to whether it be one opioid or another. It took a real bottom for me to finally really just do it. I just had to, because I have, not only that, I'm a mother, and I'm going to touch upon that, but where it really started for me, where I knew I needed help, but I was too afraid to come forward. I was a teacher. I was a teacher in Trenton, and I taught for 3 years, and that's really hard for me to say, because, obviously you don't want to think that your youth are being taught by addicts, and, it's very shameful for me. So for me to come forward and be able to not only to just, talk about it among my friends or even, my parents. I mean, think about if I had to go away to treatment, what was I going to tell the people that I worked for? What was I going to tell the principal? What was I going to tell the district? I mean, this was, a really big commitment that I was going to have to make, and I really didn't feel like I had anywhere to really turn. It was a really scary time for me. And then I ended up meeting somebody that was also in addiction, and we had a child together. So, and he ended up dying of this disease. Just to touch upon that, really, I know that others have talked about, people of overdosing and dying of this disease. I mean, it's directly affected me, and my son's now going to have to grow up without a father. He was only 2 years old, not even 2. It was a week before his 2nd birthday that, I found him on Halloween, overdosed on the floor. And I was holding my son. I was supposed to be dropping him off. Sorry, I don't mean to get a little upset, but I just really want to bring that home because, I really loved everything that they were saying up here, and it sounds so wonderful. If we could really, come together and do this, but it's obviously not easy. I mean, we have, like he, just described 128,000, people that are heroin abusers right now. I then became a mother. So after this teaching, I ended up, actually not being asked back. I wonder why, for another year. And I ended up getting pregnant. And so when I got pregnant, decided, okay, I'm gonna cut back on my using. I wasn't gonna stop all the way. I was just gonna cut back, and I was just gonna make sure that I constantly got checked up to make sure the baby was okay. And he was obviously maturing fine and everything, so that was great. Luckily, like I said, I cut back to once or twice a week. I thought I was doing really great, And my son's father the whole time was using, so it was very difficult for me. Felt very stuck. I felt very alone. I didn't know what am I going to do, talk to a nurse so they could possibly take my son away when he is born. I don't know how these things work. So education is a huge part to play in educating, obviously, addicts, because we don't know. We don't know what's okay, what's allowed, or what's going to happen to us if we come forward. So obviously, throughout my whole pregnancy, I was terrified of the day he was going to be born. I didn't know what was going to happen. And luckily, he came out perfect. And, I just touch upon it real quick. I was so nervous the whole time. And the nurse was like, "Are you always this anxious?" I was like, "Yeah, no, this is just how I am." But everything that was wrong with him, I thought that was because of me. And it was just natural things that were happening to him because I was just terrified. So I went back to using right afterwards. I didn't want to breastfeed because I knew that, I'm living with this man that's an addict. I didn't know where else to turn. I tried to make it work with him and ended up leaving him. He ended up, passing away. So as a mother now, I ended up getting treatment at one point, but I hadn't reached a bottom. For a lot of addicts, it's not gonna, if it's smooth sailing, if you're enabling them, if it's easy, they're not going to change. Like, you need to, if their drug using is working for them, why would they change? Why are they going to, do something different when this is what, they crave? This is what they feel like they need every day. So unless there's some type of bottom, I don't want to say unlikely, but it's harder for the addict to actually come to realization that they want to change. So for me, like I said, being a mom and just trying, do everything on my own, I didn't know, I didn't want to come forward. Think about it. My son's father has passed away. And now I'm going to, obviously talk about, my relapse now. I'm going to start, coming forward saying that my drug abuse is a lot worse than I had anticipated. I didn't want to come forward with all that. That was admitting it not only to my family, but to myself. It was really difficult, but I knew that the day that I ended up getting arrested in Robbinsville, my son was in the car, and it was just really it was traumatizing. It was horrible. They were wonderful, though. They didn't handcuff me in front of my son. and they, enrolled me in the care program, and I have had to work. I was a part of AA, but I've been in and out. Now I just know that with the professional help that I have today and AA, that I am going to continuously try my hardest and grip on with everything that I have to stay sober. But I'm telling you, going through as a professional, as a mother, it's so difficult to come forward when people are closed off to addicts and make you feel like you're a junkie or there's something wrong with you, or resources aren't available. Like, you get scared because after I didn't have insurance, I didn't know if there were programs available for me to go and get rehab or to get detox or to get any of these things, because they're so expensive. And they're only allowed certain beds for certain people at certain times, and sometimes when you need it, you just can't find it. And it's really unfortunate, because it was a very obviously lonely time in my life, and if we could all come together and really educate, I think educating addicts is would be a huge plus in this, because obviously when we don't know where we can turn, when we don't know what's available, when we don't know it's okay to come forward and say, hey, I'm pregnant, but I'm having a problem, I feel like if we could make that okay for them, then people would, come forward more often. And yeah, that's about all I have to say about that.
Thank you, Marissa. Thank you. Thank you for sharing that. At this point in time, we have some questions that have been provided by the audience, by folks that are live streaming as well. And I want to start by discussing Narcan. I know we talked a little bit about that a little bit earlier, and also fentanyl. And the question is, how effective is Narcan when fentanyl is being ingested by an individual? Does Narcan work?
There's been some success stories with it, but generally the fentanyl is just so strong that it's very difficult to reduce the fentanyl overdose.
Anybody else like to also contribute?
I was even saying that before. It's much more refractory than regular heroin. And there are also, there's not just one type of fentanyl, unfortunately. There's also carfentanil, which I think is 100,000 times as potent as morphine. So some of these are really terrible. I mean, you can dust this stuff off your coat and overdose. That's happened. It really is very tough. Narcan is life-saving, but it's not, and it's a godsend when it works, but it's not treatment inherently. It's not going to solve the problem. Wow. And I think what we're seeing now, and that's what I was saying before, really the third wave of the epidemic now, after we had the prescription drugs, then the re-rise of heroin, because people had run away from IV heroin in prior decades because of HIV. They were afraid of getting HIV, and they forgot that one. And they went back to heroin because they had pain pills they couldn't get. And I think one of the gentlemen mentioned the older person in Heroin Town who started out perhaps on a pain medication, then he couldn't get it anymore, he goes over to heroin. It's cheap. And the drug dealers are master marketers. They used to have a thing called the Newark bundle. They give you an extra bundle to really get you hooked. And they'll do that with the fentanyl. And fentanyl is it's interesting because a lot of times people don't even realize they're using fentanyl. They put it in marijuana, they put it in things that purport to be Xanax. People take other things and they overdose. And we will use the Narcan to bring them out of it when we can. We can't always reverse it. And a lot of times, unfortunately, it's so fast when it hits that unless it's an act of God where somebody's standing right next to you and can do CPR and has Narcan, you're going to die.
The other thing to remember, too, with the fentanyl is that it's fat soluble. So it's really changed the way law enforcement is doing business now. Every time someone picks up a deck of heroin or purported heroin, you never know whether it's laced with the fentanyl. And if that fentanyl gets into your skin, that can cause the overdose through your fat cells. And there's two folks here that are pharmacists, Shayla and Neil. The folks that are putting the fentanyl in the heroin don't have pharmacy degrees. They kind of eyeball everything. And that really creates the big problem, but it changes the way. So even parents, and if you're a teacher, before you pick something up, think about it. You may want to put on, it looks like it's a narcotic, or marijuana or a heroin deck, you really want to put the gloves on just to protect yourself, because you really don't want those accidental overdoses.
Thank you. Next question is, it's very common for chiropractic and physical therapists to see chronic and acute pain patients when pain medication is not worked. They say they hear often patients leaving the medical doctor's office with more than one prescription for pain medications. Why don't we look at chiropractic and physical therapy as being offered first, as the first line of addressing acute and chronic pain? Alternatives in general.
Well, I think there is more of a tendency to look for alternatives now. I know in a lot of the hospital I work in, we have a lot of addict and what are called dual diagnosis patients, and we will use physical therapy in an attempt to do anything aside from the opiates. One of the problems with the opiates they're a godsend in terms of the acute relief of pain. The problem is when they're chronically used. And one of the things that a lot of people don't appreciate with opiates is there is an entity called hyperalgesia, where by taking the opiates, you become more sensitive to pain. A lot of the patients on methadone maintenance, for example, they may be legitimately on methadone maintenance. They're very hard to treat for pain because they're very sensitive to it. And what do you do? The irony of the thing is that with some of our medications, for example, with the people who are on some of the opiate blockers to treat their addiction, we have to get very creative treating pain because we can't use the opiates with them; they don't work. So we're getting more strategies than we had. The one thing that I did want to point out is that we're talking about a lot of things that we're doing for people who are addicted, but I think the other real issue is to try to educate our children when they're younger. In public health, there is a thing called primary prevention. To try and treat it before it happens.
Sure.
And if you look at any of the national studies, kids are starting using drugs young. And there was a 13-year-old in Heroin Town, and let me tell you, a lot of them, if you look at the Monitoring the Future study, a lot of the kids are using marijuana and alcohol much younger than 13. So it really is primary prevention. And the fact that, you're talking about someone being a teacher and being ashamed to come forward as a teacher, right. I think historically we've been afraid to mention it to the kids because they were so innocent. And the irony of it is it's the opposite. You got to really start in early and teach these kids because they don't know what they're getting in for. I think a lot, nobody wakes up and says, I want to be a heroin addict.
That's a good point.
And they're not educated. And I think really when people are properly educated, they learn some of this stuff and they have their options, they wouldn't go down that slippery slope so quickly.
Right. Thank you, Doctor. Another part of the Knock Out Opioid Abuse series is a parent education program that focuses on parents of children in the 3rd, 4th, and 5th grade. So it's crucial to be able to start those conversations early, and we couldn't agree more. Next question is actually about prevention. We've implemented a lot of different prevention approaches in the past. The question is, do the panel support expanding the use of screening protocols like CBIRT, which is screening brief intervention referable to treatment, and this is particularly important among youth. So is there interest in getting more screening programs for young people in order to identify potential problems from expanding?
Well, I think there's an interest, there's a use in it. We use it in the emergency room. We get people under suspicious circumstances and we routinely will use CBIRT. And I think the other issue now is that there are a number of different tools that are assessment tools, and the questions are designed to be non-threatening, but they'll just ask about patterns of use. And it's not, the old thing used to be it's black and white. You're either not an addict or you're an addict. You're either not an alcoholic or an alcoholic. But again, a lot of this addiction is sneaky. And you start out with stuff like risky drinking, out-risk drinking, and it actually, if you ever look at some of the graphs of this thing, it almost segues into it. It's almost imperceptible. So the idea being, you want to catch it in the beginning. You get somebody comes in a car accident or they broke a bone or something else, you might take that as an opportunity. So we try and do that more now, and I think that it really is mandated in the emergency rooms as a best practice.
Excellent. Yes. Roy?
I would just say that in every county in the state of New Jersey, there's a 800 number that you can call. It's a statewide 800 number. I don't know it off the top of my head. But it's for children's mobile response and stabilization. And you can call that 877 number, and within 2 hours, somebody can come out, they'll do an assessment. They utilize John Lyon's strength and needs assessment, and it has a substance abuse component to it. But it's not just for addiction, right? And so it's about destigmatizing mental health and addiction, and there's often a co-occurring scenario there, and who knows what came first, the chicken or the egg. But in particular for kids, that's just free help, right? That's just anybody you just call at any time, 24 hours a day. If it's too dangerous or too volatile of a situation, then they'll involve law enforcement and have you head over to a psychiatric screening center where they'll do the assessment there. But the assessments are key. Look, the reality of it is this is happening much younger, right? I'm sure you've gone into a gas station and seen Juuls, right? Everybody who's got an adolescent, anybody here got a teenager, your kid Juuls, they all Juul. I promise you, there's a recording of it, and it has nothing to do with your moral character or what your family is doing. I'm just telling you, it is everywhere, and it is not a far leap to go from a Juul to a cigarette to marijuana that you didn't know was laced to fentanyl, with fentanyl, and before you know it, you're addicted. And the one benefit, because what we find, at least on the adolescent side for kids, the two primary diagnoses that are on the increase are anxiety disorders and ADHD, is that we're destigmatizing mental health services. And so one of the unintended benefits of almost an overdiagnosis of ADHD is the fact that kids are now becoming more used to asking for help from professionals. And so what we would just say is destigmatize the notion of asking for help, right? And we have to create that environment that makes it so that there's not the judgment attached to someone asking for it.
Excellent. Okay, we're going to now open up the floor for any questions. There's microphones at both ends, and it is being recorded, so if you could please speak into the mic, that would be very helpful. You could just step right up to the mic.
Mr. Onofre, I had a question for you.
Sure.
You had mentioned that Mercer County is a source county. What makes Mercer County a source county over like Essex County or Hudson County or one of the, more non-affluent counties?
Geography. Very simply, we're very close to New York, very close to Philadelphia, and you can take an amount of money, go there and buy it, and literally double it by selling the heroin up here. Mercer County has a great roadway system. It's very easy to transport between New York and Philadelphia, and there. And by Mercer, it's really the city of Trenton is the source city here. Patterson, Newark being the other, Camden also another one. And it's all geography related to New York and Philadelphia.
Thank you.
Okay. If anybody has other questions, you can come up to either mic. Yes, please.
Yeah, my name is Stan DeWitowitz, and every day we hear in the news about the opioid epidemic and the crisis. Every day the media says something about it. And I was injured in a work-related accident in July 2016, and dealing with workers' comp and injuries I sustained, including a broken back, compression fractures, and tore up knees. The opioid medication has been the only thing that worked for me. Now I am also become advocate with the New Jersey Pain Advocacy Group, C50, a coalition of 50 states, and I'm from the New Jersey chapter. And what I want to I've been tapered down because they've been tapering down the opioid medication across the board. And I know that somewhere along the line I'll recover and almost be functional again and be in less pain. But as I've progressed into the advocacy, because I can't work and I have time to get on the computer, I see people who have incurable illnesses and really tragic injuries worse than mine, and they're being tapered down. And what they did to the vets with the VA, that the vets would wind up showing up at the VA and commit suicide because they couldn't get the meds anymore. And what we don't like is that we're getting classified with the addicts, and either that or we're treated like we don't exist. And the effect is making us like victims of the opioid crisis and the chronic pain patients who can't get the meds that some of them have been taking for decades. And if you go on any of the pain groups on Facebook, you'll see the horror stories of what people are going through. I'm fortunate that it ain't as bad for me, but still, I see the people affected, and I just wanted to make it known that people do exist who take these things legitimately. And opioid, I mean, it's bad in a way for the addicts and everybody else, but there's some people who are responsible with it, and they do take it, and they have to just to maintain quality of life, to do their housework, to see their grandkids.
Thank you. I guess the question is that, is there any research that demonstrates that long-term opiate use is an effective tool to address both acute and chronic pain?
I think there, you know, the intent of most of the regulations, or at least the intent of them, I don't know if it always splits out that way, but the intent is not to deprive anybody of pain medication. I think there's a group of people who very legitimately require long-term management of pain, and I'd even said that before, of opiates. The problem has been that we really haven't had education of the professional public in terms of delineating who's who. And it cuts two ways. It was very eloquently stated just now. One way it states is you don't differentiate anybody. The other way is you just give everybody opiates. So we're trying to delineate it better. I know the American Society of Addiction Medicine is very focused on that. A lot of their education has been a program called Common Threads, and it's separating out addiction and pain management. Very often there are people who have addiction who require chronic pain management, and some of them have had terrible injuries and require opiates. And that is very tricky, and it requires a specialist. The problem is that, again, we have people who have provided these medications who do not have the expertise, unfortunately in some cases don't have the ethics, and haven't done a very good job of policing it. If someone had diabetes, you wouldn't just throw insulin at them and say, figure it out. You know, there's a whole strategy of how to use the medication appropriately. And I think the intent has been to try and separate those groups out. I don't think that's always happened, which is unfortunate, but again, I think that's the ricochet of stigma, where sometimes you're not differentiating who's who. And again, I think we need education. We need education in the public and better education of the professional public.
Great. Okay, please. Before we get to this question, you can come up. We have a question from someone online. They say they're a Robbinsville resident and they don't have much time to volunteer, but they want to know how they can help address this crisis in the community. So is there a place that they can go? Is there an organization they can seek out to get to volunteer?
Sure, contact the mayor's office. You know, Jody Stevens would love to have more volunteers. You know, the CARE program is expanding now to beyond just arrests. We're now actually taking walk-ins. So we can always use trained help, and we can always use volunteers.
Okay, thank you. Sir.
I say thank you, everybody. My name is Neil Tucker, and I come kind of with a three-prong approach. One, I have long-term sobriety. So I understand, Marissa, thank you for getting up there and sharing that story.
Thank you.
I'm an EMT in Mercer County, so I see it from that perspective. And I'm also in a career where I sell emergency oxygen, and we're partnering with Narcan. And so the point in all that is that it's a very complicated issue. But so part of this, I wanted to speak to the Reverend, if I could, because I don't think we have we don't have this crisis, we have a crisis of purpose in our society, right? And addictions is a spiritual disease, right? And so for the folks in the audience and just sort of from your perspective in the community, how are we bridging that gap? Because it's a medical condition, it's a brain condition, it's a legal, right? It's just so complicated. At the end of the day, you walk into the rooms of AA, you walk into recovery, it's something happens that medicine stops the doors of those rooms, right? So, you know, I'm just curious because, you know, I could go to different areas, like tell me about emergency oxygen, or tell me about, you know, what it's like being an EMT. At the end of the day, I'm looking to walk out of here and hope the group can walk out of here to know that there is a solution, you know, and I think it's a spiritual solution. So maybe you could speak to that.
Well, you brought up a couple of good points. You brought up the AA program and you brought up the NA program. The AA program and the NA program, they were based off of spiritual principles. We know that the AA program came from what you said, the Oxford group, which was it was a group of men that dealt with, as we said, the Word of God through Jesus Christ. There was 28 steps. When Bill Wilson came with the doctor, they broke it down to 12 steps. Well, it's still the same thing. It was the spiritual principles that guide people to recovery, okay? So what I would say as far as the spiritual aspect of it is, and I'm talking to all the faith-based groups, whatever your spiritual book of discipline is, when you adhere to your spiritual book of discipline and you follow each step as far as your spiritual book of discipline, you can move forward in your life. Recovery is a process. And as you continue to move forward in that process, you still have to go back to the spiritual book of discipline which you went through. You talked about the AA group, you talked about the NA group. And I just say that, listen, they are awesome groups. They are great groups, and they are the things that, number one, you have to come to an acceptance that you are powerless. Number two, come to the acceptance that there's something greater than yourself that can relieve you. And then come to the acceptance that this is the God who I'm going to serve. Those are the three things. So I would say that moving forward I'm talking about to the audience, moving forward, if you have a family who is going through and you want the best for them, once they get done with the IOP program, once they come out of a inpatient program, I would say get them involved in a spiritual-based program as well. I'm telling you, I know it worked firsthand. You know, I've seen it work. Now we're talking about education. We need to educate the people about what's going on. The prosecutor said something about the sources being in Trenton. Well, let's talk about that. On every corner in Trenton, not only do you see a drugstore or alcohol store, you see a church or some type of form of worship. That's what the faith-based group needs to do. We need to come together and open up our doors. And I'm glad you said that. We need to come together and open up our doors, because finding a support community and building a strong relationship is essential for ongoing recovery. So spiritual principles is important.
Thank you, Reverend. Come on up. Another question I just received was, what should I do if my doctor or dentist prescribes an opiate to my child? Should I look at alternatives? Anybody want to address that question?
I think you need to have a good conversation with your doctor or dentist why he's doing it, for starters. You know, it's a very slippery slope, because really, you know, the opiate is only a substance. And, you know, fentanyl is something else. But if you're talking about medically prescribed formulations of opiates, they're a tool. And like any other tool, they can be used for good, they can be used for harm. But I think the question of the indications for acute and chronic pain, how much education the person has on this thing, and have a real dialogue with it. And the other thing is, if you're not satisfied with it, you may need to get a second opinion. You know, it's not a simple situation, but I can tell you that, you know, certain modalities will see things that are very good in theory. For example, some of the medication-assisted therapies. I've worked with a lot of people who provide them throughout the state. There are some very good people who are providing medication-assisted therapy, and there are some people who are absolutely terrible. And, you know, again, some of that can be the ethics of the individual person, the education, but you really need to be an educated consumer in this. And in the case of your child, you need to be an educated consumer for your child.
Okay. And the follow-up is that considering a child's brain is still developing well into their 20s, should a parent be especially concerned about
I think
introducing an opiate?
that goes notwithstanding. You have again, a lot of the, when I was listening to some of the stuff about the spiritual aspects of the disease, it's kind of interesting that the people who founded the 12-step groups and even the Oxford group ahead of them, they anticipated a lot of things that we have subsequently found out from neuropsychiatry when we learn more about the brain. And one of the things in younger people is there is an area of the brain that's called the prefrontal cortex. It isn't developed until the late 20s. Now, psychiatry's only known about that for about 10 years, 15 years. The military's known about it for millennia, because that's why they draft young people, because young people will fight. If you go like a 40-year-old guy and say, would you like to walk into that cannon, you're invincible, he's going to say, really? But it's not developed. And a lot of, with a lot of, even some of the other substances than opioids, some of the kids really are at risk. I mean, there is literature about marijuana that giving it to young people with a family history of mental illness, that could trigger it off for them. It's a susceptibility. I think the other thing I wanted to mention, though, is in terms of what the Reverend said, it's a brain disease. And one of the things that runs right along with what's being said about spirituality is it affects the center of the higher center of thinking, which is the cortex. And what happens is the reward center gets hijacked and takes over, and it robs a person of their humanity. That's why somebody with a small child chooses to die, or some of the other horrible things that people do when they're under the influence, because this is not in control anymore. And one of the things that I've seen, because we do use a lot of interface with spiritual programs, I find that the involvement with spiritual programs helps to restore people's humanity. We don't have a pill for that.
Thank you, Doctor. Next question.
Hi, my name is Ernie. I've lived in Central Jersey since 1983. I'm trying to make sure we include in the conversation the millions of Americans living with chronic pain, estimates between 25-70 million Americans. For a couple years now, we've seen the promotional materials on the nightly news about the war on drugs, and state legislatures have been pushed into trying to do something about it. In 2016, the CDC issued some guidelines for doctors for prescribing. These were regulations that the FDA had previously rejected. The intent is one thing, but a lot of legislatures, too many, have adopted them as law or pushed as regulations. And what we see is too many doctors across the country stopping prescribing, okay, in some cases being raided by DEA and put out of business without ever being found to have done anything illegal or wrong. Uncontrolled pain is bad because it damages brain tissue. It affects judgment and emotional stability. When doctors stop and people are cut off from their long-term opioid pain medication, they are all of a sudden unable to go to work, unable to get out of the house, unable to get out of bed. Some people would not be able to come, to an event like this tonight because of uncontrolled pain. In states where they have cut back a lot like that, we've seen a spike in deaths and suffering and suicides from uncontrolled pain. So what we really need to do is make sure that people preserve access to their long-standing, safe and effective prescription opioid pain medication.
Thank you.
Well, again, I had said that before. I treated a lot of first responders, a lot of people that have been injured in the war, and those guys really, they need the pain medication. There's no question. So I think it's unfortunate when we get the two groups blurred. If you look in the Diagnostic and Statistical Manual of the American Psychiatric Association, that's what we use to define what is a use disorder. They don't even call it addiction anymore, by the way. They call it a use disorder. It could be an opioid use disorder, cocaine use disorder, alcohol use disorder, any of those. But for any substance, there's 11 criteria. Only 2 of them have to do with tolerance and withdrawal. Most of them are behavioral. If you flip that on its head, there are people who are maintained on opiates and function, either because of chronic pain or in some cases they're on long-term opiate agonist treatment, good agonist treatment for addiction. and they function, and they're not stealing TVs and robbing stores and out of control or anything else. And with any of those groups of people, including the non-paying people that are being treated for addiction, it's a terrible thing when they're suddenly cut off. I've had people who went to methadone clinics who were doing very well. They ran out of insurance, and they were suddenly cut down to nothing and went to the streets for heroin. I think it's terrible. So again, it's a matter of education and figuring, trying not to do this one-size-fits-all business or being pejorative or judgmental about these groups of people, and figuring out what's legitimate and what isn't. And I think we all need to be better educated in that.
Thank you. Thank you. Next question I have is about schools. Are the schools in Robbinsville doing anything specific to talk to students and parents about the opiate epidemic and drugs in general?
Guess I get that one. They are. We are, we're doing a number of different things. We are absolutely having educational courses. The prosecutor's office, he was actually a little bit tardy tonight, but it's because he was actually in one of the schools in Hamilton. And the prosecutor's office has been leaders in this. They've been going into every school and every community and trying to have open conversations with our kids. In Robbinsville, we've actually put a police officer in every school, one for protection, but for two, to constantly be talking to our children. And we want to change the way that our kids interact with our police department. It used to be you only dealt with the police when you were in trouble. Now we want to have a good relationship with our kids. We give out baseball cards. We're trying to have the kids know that they can come to the police department whenever they have a problem, before they're getting in trouble. When they're on the verge of being in trouble, they can actually reach out and feel like it doesn't have to wait until someone actually lands on their doorstep, but they can be proactive. And that's really the relationship that we want to have with our kids, and we want to continue these conversations, and that's how we really believe that we're going to win. We have to kill the stigma. I wanted to give you a hug when you were talking down there. I mean, the more we bring this into the light, I say this to everyone, the more we bring this into the light, the more that we talk, the more that we get rid of the stigma, the more we're going to win. It's how we're going to win.
And the program that's in the schools was really formulated by my first assistant prosecutor, Stephanie Katz, who's in the back of the room. We were approached by Mayor Freed and Kathy Foster, the superintendent of schools, really to bring something in to talk to the kids, and particularly to the parents, because parents, don't take this the wrong way, you're completely clueless. And the reality becomes, what we've done is kind of twofold. When we do it again this year, we're going to be showing the students a film that was done by the DEA and the FBI called Chasing the Dragon. And it's about heroin addiction. And it's very stark, it's very real, it's gritty. There's one person who was addicted in it, that their person, in order to stretch how far the heroin went, it's called cutting, where you take that pure marijuana, put some, heroin, put some stuff in it, and it goes. Well, this one drug dealer was shoplifting meat tenderizer and putting that in the heroin. And at the injection site, that person's flesh was so tenderized that it was causing lesions. And that's something the kids need to see, because you have no idea what is being put in these drugs. And for the parents, we do something a little different. We'll show you how the drugs are packaged. We will show you something that we've done in cooperation with the DEA called Hidden in Plain Sight. And Hidden in Plain Sight is really the different hiding places and the products that are available online that the kids are buying the high drugs in. Coke cans, Fix-A-Flat cans. There was one where it was a Walkman. Anybody remember Walkman?
Yeah.
What kid has a Walkman in their room? That should have been the first thing.
Right.
And you get, the kids are very innovative, including even with the vaping now, that they're selling sweatshirts where the drawstrings are being used as the vaping device. And when you do talk about the vaping, and it's something that we do touch on, when you get the THC oil within that, it's 98% pure.
Yes.
I just want to touch upon that, because I think showing kids the reality, like I obviously went to school when the DARE program was around, and just telling kids to say no to drugs, I'm sorry, Obviously, that didn't work for my generation because, I mean, obviously, as you all know, my generation is dropping like flies. I'm 32. Well, whatever. But I could have just left it at 30. But no, I mean, just telling kids to say no and obviously not having really, really strong open conversations with them about the reality. Like, look at, I mean, and some parents I've heard, they don't want their kids going to school those days because the harsh reality is ugly and it is painful and it is sad and it is, you know, harsh. And then some parents obviously are opposed to their children being exposed to something like that. But in reality, that's what's going to keep, if anything, that is what's going to keep them from going out and using. That's how I truly believe.
Thank you. There's a follow-up question. Is there something specific about athletes, and are they vulnerable?
Well,
student athletes.
Yeah, I mean, there is. A lot of times what happens with the athletes, there's such a rush to get them back onto the field. And in 2017, Governor Christie signed the law that limited initial prescriptions to 5 days. Yeah, how many people have gone when you've had your wisdom teeth out and they give you the 30-day supply but tell you not to use them? Okay. And what we try to talk with the athletes, and Barb Spreckman from the Prevention Coalition in Mercer County is here, hosted a forum last year for all the athletic directors and fall coaches to really talk about how it's not worth getting the student back on the field if there's the potential that they're going to become addicted. And part of the law Governor Christie signed was for the physicians to talk about alternatives to using the opioids. You know, whether that's Advil or Tylenol or a mix, something that's not as addictive. It's all now required by the law, but parents, it's not worth your kids' health by trying to force them back on the field.
Yes, I have a question on this end.
Good evening. First off, thank you for doing this. For those parents that are in this room right now and first time hearing all these numbers, I hope you're getting woken up to what's really going on around here. Coming from a father that has suffered the unimaginable pain of losing a child to this disease, you know, we really don't want any of the family to suffer like that. And thank you, Jody, for asking me to come. I really appreciate that. Angelo, you know, there's the care programs and everything. It's all great. What's going on with that? And high school programs. I know our family's been part of that and behind that from the beginning. Is there any movement on? Now I'm a Narcan advocate with being affiliated with TOPAC, but there has been any movement on the mandatory detox if you are hit with Narcan or mandatory rehabilitation. A lot of times people are being hit with Narcan and are able just to get up after they were dead and say, no, I'm not going to the hospital, I'm going to go home and use again, which causes a whole other level of frustration from our police departments and from the families that have just witnessed this happening and then their hands tied behind their back and watching the police or the EMTs leave and they're powerless to know that this is going to happen again, maybe within a matter of hours. So my question is there any type of movement going forward here with Narcan as far as mandatory detox situations when you are hit?
There is. There's a lot of movement in the legislature to make it mandatory that if a person is revived through the Narcan, that they have to go into detox. Mm-hmm. What we have here in Mercer County is the opioid overdose recovery program that's in all of the hospitals. That if a person comes in having experienced an overdose and they get revived, the emergency room personnel are very aggressive about trying to get them into treatment now. On top of that, the Narcan, it's being used a lot on the New Jersey transit trains and at the train stations. So they're not folks from our community. And what's happening now is people are coming in and they have a buddy system. Okay, I'm going to use now. And then you call 911 so that the police get here right away and I get the Narcan. We also have, and it was, you know, unfortunately a horrible experience that we had back a few years ago. And I noticed a bunch of people took the start packets that we have. That has every resource in there that you need to get somebody help. And what we found with this, and this was the precursor to the overdose recovery program, but when folks were getting Narcan, we had an experience where an individual was Narcan twice within 24 hours. They checked that against medical advice the first time. And then when the police were back there in less than 24 hours the next day, very affluent section of Hamilton where this occurred. This time when the individual was taken to the hospital, parents were there. And they were given that opportunity to get all those resources and get their son into treatment. The big resistance in the legislature, as everybody knows, is money. With funding it and with getting the insurance companies to get on board with it. So that's an uphill fight. Linda Greenstein, who is our senator, is one of the champions of that bill, and she's fighting every day to get that through. The Senate just passed legislation that urges every police department in New Jersey to carry Narcan, which I think is important. And the thing with Narcan, and you brought up a great point, when someone has an overdose and they are revived through Narcan, we don't call it a save. It's called a reversal. You've reversed that overdose. It's not a save until that person gets into treatment and is in recovery. That's when the reversal turns into a save. You and I have talked about this a lot. You know I'm behind this.
Appreciate it.
And it is something, and again, I can't emphasize enough that you're never going to arrest our way or prosecute our way out of this problem. You have to treat that addiction. You have to treat that disease. And the Narcan really is the mechanism to give the person a second chance.
Thank you.
Thank you.
I can't, just one real quick, I can't tell you how much I wish that I could have been sitting here 10 years ago, or even 5 years ago, that we're coming up on the anniversary date of Christopher's death. The awareness has exploded throughout the country, throughout the state, but yet our numbers are still climbing, which is incredible what's happening. But again, I really appreciate the effort that not only you guys and girls are doing, as well as Recovery Advocates, City of Angels, TOPAC, and everyone else that's trying to fight this fight. From a father that's been affected, thank you. Really appreciate your effort. Thank you.
Thanks for all
Thank you. Just continuing on the Narcan issue, the question is there facilities or training here in Robbinsville on how to utilize Narcan and how to get access to it?
Yeah, my office, and Agent Matt Kemp's in the back, he's a certified trainer. Matt's a retired lieutenant out of West Windsor. West Windsor was one of the first departments on board with the Narcan. TOPAC, that Kip mentioned, is run by our friend Paul Ressler. They provide training. My office provides training. It's there. All you need to do is ask.
Thank you. Yes, next question.
Thank you. Good evening. So my name is Lieutenant Commander Tanisha Mitchell, and I want to thank you for the informative session tonight. I am here representing CMS, the Centers for Medicare and Medicare Services, and I work out of Region 2. We cover New York, Puerto Rico, and the Virgin Islands. New York, New Jersey, Puerto Rico, and the Virgin Islands. And I would like to start out by saying our focus is prevention and treatment and using data to inform those decisions. And I was very pleased this evening to hear that you have the same strategy. And also, I want to say thank you to you, Reverend. I work for the Surgeon General. I am a United States Public Health Service officer. That's another hat that I wear. And I'm also a physician assistant. And my question is for you tonight. I attend church in New York City. I live in New Jersey, attend church in New York, and I work in New York, so I'm all over. Yes. And what I wanted to do with my license over a year ago is to use it to dispense Narcan, and I wanted to dispense out of a church because I felt it was a safe, stigma-free place area, and it was, everyone would come to the church, and it was a great place. The church should have their doors open to extend that service, but there were a lot of barriers. It took over a year. I'm pleased to say that I'm currently working with the Archdiocese in New York, and we're dispensing Narcan out of a church in East Harlem, which also has a very high rate of overdoses. My question to you, do you think that would be something that the faith-based communities here in Robbinsville would be open to doing, dispensing out of a church?
Well, coming to Robbinsville, just being a pastor here for just 3 years, I'm at First Baptist Church of Robbinsville, 22 Main Street. If y'all heard of Little House on the Prairie, we're the little church on the prairie. Right. Let me give you a spot. Papa's Pizza is in front of us, so now you know where we're at.
Yeah.
From everything that from meeting the mayor and him coming to visit the church and meeting Pastor Greco and just being involved in this awesome, awesome community, I know I can about say 100% sure that this community will be, the churches in this community, I know I will be supporting it 100%. And I'm part of another organization of churches, and I would love to push that as well, because I believe that this is what it's about. We collectively have to come together and work together with government agencies and social agencies, whoever we need to work with to get this thing under control and to win. We're there.
Okay, thank you. And I would love to share, what I've been doing to have that move forward. And also, if anyone, this evening, I'm here to, CMS, we have a lot of resources, and
Absolutely.
If you have any questions, I'm here. Thank you.
Thank you.
Thank you so much.
And thank you for your service.
We're going to go to our next question, but before we do that, this is exactly the main purpose of the town hall meetings, is to be able to exchange ideas, come up with ways to be able to combat the issue, address the problem, save lives, and we're so appreciative that you came up and spoke to giving us a suggestion that we hopefully will be able to implement here in Robbinsville. Next.
Reverend, I'm going to piggyback off of what you just said. We have to come together, I think, as a community to combat this. My name is Neil. I'm the owner of Hickory Pharmacy. It's a locally owned pharmacy right over the border of Robbinsville and East Windsor. We're doing a lot in this space right now, as it is. We have a lot of folks who use heroin who come into our pharmacy and get Suboxone for treatment. But it doesn't stop there. It goes beyond that. And the issue that we're finding is that a lot of times when patients go into a pharmacy that's busier, chain pharmacy or whatever it is, that pharmacist isn't having that conversation. And a lot of the questions that came in the room here tonight are regarding medications. And the folks that are on chronic pain medications, that's one set. But there was a question regarding, I think it was an online question that was regarding if my dentist prescribes an opioid to my child. That should be, in my mind, a time where the pharmacist steps up and says no, that there are other alternatives. What we're doing at our pharmacy is we were just approved by the Department of Health in New Jersey to dispense Narcan without a prescription at our pharmacy. And until tonight, and hearing all the folks speaking here, we were dispensing it with prescription insurance. I'm proud to say, I think Mayor and Angelo, I think we're gonna do a lot of work together moving forward. But what we're gonna do moving forward after tonight, after hearing all this, we're gonna give it for free. Anybody who wants Narcan. Anybody who wants Narcan can come into my pharmacy, speak with me. And it's not just about, and a lot of questions around Narcan, it's not just about getting Narcan. It's about education.
That's right.
It's about education. It's about how to do CPR, understanding signs of opioid overdose. Already what we're doing is any patient who comes in, a chronic pain patient who's been already stabilized on that medication, we're giving Narcan with those prescriptions. Even if they got it last month, we're giving it again. We're giving it again. And the reason why is because if they can give that to a friend who they know are using or abusing or whatever it is, or on chronic pain medications, they can save a life. And I know that Narcan, as we talked about, it's not saving a life, as you mentioned. That's the first step. But with a Narcan dose that's administered out of, or dispensed out of our pharmacy, we're going to give CPR training. We're going to also give education on overdose. We're going to also talk about next steps. And Mike, I don't know if he's still in the room, Mike Sicardi, we're going to work with some of the different recovery advocates of America, as well as some other addiction agencies, to try to close that loop. And a lot of the questions that we got today, I think that the pharmacy portion is that part of the loop that needs to be closed. It has to happen from the pharmacy, and I think that that's the portion that is missing. So I'm proud to say that we're going to be working with, especially Mercer County. You know, we're going to give it out. So anyone who asks for it will be able to do that. And I'll be here if anyone has any questions regarding prescription medications, pain medications, as well as anything else. So thank you so folks, for what you're doing, and thanks everyone for coming out. I think this is a great forum.
Yes, thank you. Next question.
Hi, I'm Mary Caffrey. I live in Robbinsville. For Angelo, or even the mayor, just in the last month or so, there's been a new round of information that's been come loose through legal proceedings. Some news organizations have gone after the family that owned Purdue Pharma to shake loose their efforts in the early marketing of OxyContin to show just, you know, lies that were told about, and you know, misinformation that was given to doctors who did early prescribing based on bad information. Would New Jersey or the prosecutors collectively, or even an individual town, consider, you know, filing new action to get money from them to support a lot of the efforts, or maybe to get people into treatment with those funds? Would that be something that would be considered from the prosecutors, particularly if we are a source?
Actually, Mary, not from the prosecutors, for the simple reason that we don't do civil work. However, the Attorney General did join in the lawsuit against Purdue Pharma. And I think it's 21 other states that were involved with it. So that lawsuit's already been filed by General Graywall.
I just want to add to that there are some counties that are filing suit independently as well. We were up in Sussex County earlier today for a drug-free workplace meeting, and the Sussex County freeholder indicated that they were going to be filing this week, actually, a suit. So it's not only being done on a statewide level, but also at the county level. Yes?
I just want to make sure that everybody leaves here understanding that you all have, every single person in New Jersey, you don't have to worry about paying for care. That you all qualify. If you have somebody who suffers from substance abuse, then in the state of New Jersey, if you have a kid under the age of 18, right now, I can get them a bed like that across the state, right? There's providers that have empty residential beds, and you qualify for that regardless of what your private health insurance is. If you are an adult, or you know an adult who suffers from addiction, and they need services, they qualify, because it's what's called a behavioral health care carve-out for Medicaid, which means regardless of what your income status is, you will qualify for behavioral health care Medicaid. And there are a myriad of organizations that provide those services. Catholic Charities is back there. Right. I've got Legacy Treatment Services. And so there's private pay and out-of-network and expensive stuff, and then there's literally Medicaid-funded beds, which, you know, that are throughout the state. So, and whether that's outpatient, medication-assisted treatment, and sometimes there's a wait for that, and we're trying to build that capacity. That's one of the barriers. But the funding is there in New Jersey for people to get service.
Can I ask Marissa a question?
Sure.
You spoke about when you were trying to figure out what to do, when you were, like, you knew you needed care, but you didn't know where to go. Mm-hmm. What would it have taken to connect what Roy was just talking about to where you were? How could that connection have occurred?
Because it's not just known information. It's not something like, obviously we're having more conversations today, but I mean, I started, you know, on and off using 8 years ago too, we're saying. So, I mean, now obviously I have connections with recovery advocates and City of Angels and AA, so I know these things are available, but it needs to be told in, you know, in schools maybe, or, you know,
right.
Just, it needs to be information that people obviously can just know. I mean, put it across radio stations or wherever you have to, but it's not just known information.
I guess my question is, where do the healthcare people need to find people when they're in the state that you were in? Like, where does the intervention need to happen?
I mean, obviously, we're just everyday people. We're walking around the streets. I mean, I don't know exactly how this needs to be done. I mean, like I said, schools, maybe hospitals, or, you know, obviously when they're, you know, distributing Narcan, they can let them know about these programs or whatever you have to do. I mean, we're just, you know, everyday people walking around, and it's just wherever you are.
In my experience, recovery is just a very individualized journey, right? And so there's some similarities between it. Between the stories that you can find some common threads, but each person's journey is their own. There's a common, you know, theory, an addict needs to hit rock bottom in order for them to get better, but some people don't have a rock bottom, right? Some people's rock bottom is death, and so the idea is to put the resources out there, and then in my experience, in my organization's experience, there's a window. There's a really brief window for each addict when they desperately want that recovery. And that's, sometimes that's in the ER, sometimes that's at home with a loved one when it all just falls apart for them in a time when they just can't do it anymore. And it's in those moments that those people need to know that resources exist, and that's when they have to be there, because that window closes like that, and then it goes all, you know, the cycle just starts all over.
I just want to add, one of the things we learned during the previous town halls on a countywide basis was there's several counties that have a program called Hope One, and it's a van that goes out, and it goes out to shopping centers, supermarkets, parking lots, sport events, and it brings the message to where most people are. And so it's a great way to be able to make sure that people, everyday people that are walking into a supermarket are going to be able to get access to information and become knowledgeable. As a result of the town hall, this was shared, and now there are, I think, 4 or 5 counties that have these Hope One vehicles that are out in the community getting the message out. So you don't have to go to an office complex in your town hall. Your town hall is going to come to you and share this information. So it was a great lesson. Yes.
Yeah, that's one thing that I think is very important. I was just at work today, and it's a young lady who works with us, a clinical case manager, and she said that I didn't know all these resources existed. Now, this young lady has her master's degree. She hasn't been around, but because she worked and have to link up services, she's learning that there's resources out there. So my thing is, we have to get the message out there. We have to get it out there. How do we get it out there? The doctor said something real good. He said, start it when it's young. How do we get it out there? Community. I believe that churches should be a informational resource center. See, back in the day, before there was welfare, the churches and the spiritual places had the information, and it was going out. So we have to have the resources to go out there. We have to let the churches be an informational resource center. Let the children start learning. Let's just get the word out there, and I believe that we'll start moving in the right direction.
Thank you. Yes, Mayor.
If anybody's listening in the area, I really would encourage you, if you think that you have, anything happening, I can't tell you how many times I sit with the kids and I'm like, all right, just give me the jewels. I don't even ask if they have one, because they all know they do, and you'd just be amazed. They start handing them over. So just take it for granted. Have a brutal conversation. If you're not sure what to do, go to the police station. We have walk-ins now. The real trick is to get with professionals who have done this before. We have access to the recovery of advocates. When you hear from someone who knows what they're going through, when they can actually sit down and talk to them like a person, have this real conversation with them, that's when you get a lot of success. So ask for help. Okay. There's lots of resources out there.
We have time for one more question, but before we do, there's a question that came in, a question about disposing medicine. Is there a place to dispose medicine in this community of Robbinsville and also in the county?
There is. Every police department here in Mercer County, including Robbinsville, participates in Operation Dropbox. They are refurbished mailboxes that people can just come, drop their unused prescription medications in, and there's no questions asked. They're disposed of periodically throughout the year. And that's also something very important, because what we're finding out in the community is that with a lot of the open houses that occur, when people are walking through and looking at different things, they're opening the medicine cabinets and taking anything that looks like that they might be able to use. And also the kids are taking them too. There's parties, PHARM, farm parties, that are going, where you bring a bottle of medication, pour it in a candy dish, and the kids just take them. You know, with me, they'd have lower blood pressure. But the reality is it's very dangerous, and please utilize it. It's a free service, and whenever we do any kind of public event, Mayor Freed was gracious enough to host the International Opioid Overdose Awareness Day last year. We had a mobile drop box at that.
Thank you.
So the stuff's out there. You just need to use it, and it's at every police station here in Mercer County.
Please.
Hi. First of all, I want to say thank you. Very educational. It doesn't matter how many times I hear this message, I learned something. A comment and a question. First of all, I am the Robbinsville Board of Education president. I just want to say there are 3 programs coming up in the next 2 months. Angelo and his team will be back out to the schools at the high school doing a program. I think that's in May. There's a program later this month that is the Mercer County, all the Mercer County soups have gotten together and put together some programming. I know there's a vaping session in there, et cetera. And then there is a parents' meeting on the new drug policy that we are trying to pass to do drug testing beginning next year. So that's my comment, and check the Robbinsville website for the dates. I don't have them in the top of my head. Secondly,
April 30th.
April 30th. Great, thank you. Secondly, I have a question, and I wonder if you guys could talk a little bit more about the gateways especially for our students, for our teenagers. I know we are extremely worried about the vaping situation and not knowing what's in those vapes. And we're worried that it's happening in 6th grade, in 5th grade, and very, very concerned about that. So if you might address that. Thank you.
I can tell you, I was with the kids this weekend, and I was reading the warning on the vape box where it says it will cause cancer. Not, cigarettes used to be may. It gave you a little bit of an out. Will cause cancer. So having these conversations with the kids, I think, is important. I just wanted to mention, I really commend the school district. I know it was a bold move going through that testing program. I know you got a lot of pushback, but I really commend you for taking a tough stance. I think it was the right thing to do, and I think it's going to actually save lives as we move forward. So I really commend you guys for doing that.
Thank you so much. We have one question for the panel that is, what have you learned from interacting tonight with the audience, and what specific action items might you consider as a result of today's discussion? And what we'll do is this will be the final question, so we'll start Marissa and we'll go right through. So.
Oh, wow. I mean, I really enjoyed listening to all the experts and what they had to say. I just hope that we do move forward and start implementing, more programs in the schools, and obviously making this information more available to the public. Because like I said, with my own experience, it was, I just felt alone. I didn't know where I could reach out to. Also the stigma. I mean, we really have to make it clear to people that it's okay for them to come and ask for help. They won't be called a junkie. They won't be put down. They won't be made feel like, dirt. Because obviously, and I hope that a lot of people understand that it's not a choice, obviously, I guess, there's that discussion, but anyway, it's a disease, and it's not something that anybody feels proud of. We're ashamed, we're embarrassed, and it's hard to come forward. So if we can just, obviously, have the church available to us so we can walk in and have information there, or, obviously be able to connect with our mayor about talking openly about these things, and have these programs in the schools, and just a lot of these things. These guys said really great things, so everything they said was wonderful.
Reverend?
Ditto. Awesome. She did awesome. Just again, what I got out of this again, I want to connect with Surgeon General Worker. Okay. But that there is more work to do. We have to get the message out. We have to the awareness with education and with training. Awareness is no good if we don't educate and we don't train. And if we don't educate and train, we're not moving forward. I definitely want to stay in connection with the CEO of Legacy, the charity programs, definitely Mayor Free, who's awesome. Looking forward to him coming back to this church again. And everything that's going on, I'm just excited. And I will have to say this, that just in case it's on TV, he talked about Legacy, he talked about charity. One of my boss might see me, hi, Oaks. And how you doing, Oaks? They're part of the program as well. But we're just going to continue to work together. And I want to give my applause out to Robbinsville, the police force, and the prosecutor's office, they're awesome. And I'm not just saying that because they're here right now. They're awesome. And I just also like to say about the courts in Mercer County that I've been involved with for 5 years because I go in there. I think that they're an awesome group that's already been working to help people. You know, I can name all the judges that are all doing awesome work. But I just want to say, you know, especially Judge Lyden. Thank you, Judge Lyden. He always works hard for the people who we serve. So again, just connecting, moving forward, and just doing the thing that we're supposed to do as a community. And I love Robbinsville.
Thank you. Roy?
Well, first what I learned is I've been called an expert like 4 times tonight, so I'm telling my kids I'm an expert. Because nobody will believe that. Look, here's what I learned. First off, Mercer County, Robbinsville is unique. The ability to, some of these town halls aren't going to go this way. And so the unique ability to have honest discussion and represent several different aspects and facets of this disease is nothing short of amazing. And of course, it takes place in Robbinsville. And so, you know, this is a phenomenal community. And then the last thing is, you know, the only thing that we could hope is that at the end of the night, we came away with something that will have lasting and impactful change, right? So that's, like, as a CEO every day, you just try to make things just a little bit better, right? And so the notion of Narcan delivery and Neil and connecting those services and that commitment on your part, and we'll echo that and make sure we can hook folks up with some mental health services or addiction treatment if they want it. That's lasting and impactful change that happened because this conversation took place the way that it did tonight. And so I don't know what more you could hope for.
Thank you, Roy. Mayor?
Well, let's see. First, I'll give a plug to the Baptist Church because I have been there, and the Reverend's awesome. You should stop by, and after service, you can go to Papa's, so you can actually have a twofer for the day. A win-win. But for me, you know, we're blessed. I mean, I'm just going to continue to listen. I mean, you know, what I've learned is there is no easy solution, you know, and we have to keep an open mind. We have to be willing to try new things. There is no perfect answer, and we have to just keep communicating with one another. You know, my takeaway is I'm going to pray. I'm going to pray we get rid of this stigma, because once the stigma goes away, we're going to have more people talking. We get more people talking, we get more people listening, we're going to have more big ideas, and the more big ideas we have, the better we're going to do. So that's really what I hope we're going to be able to continue to do, because that's how we're going to win. We're going to win by just having new and unique ideas and continuing to just, you know, continue to love on one another until we get through this.
That's right. Thank you. Doctor?
I'm not from this community, but you know, hearing the array of diverse input comments here, I was very impressed. You know, I was sitting here and thinking, I just wish every community had something like this, because basically everyone I've ever met that's been afflicted with addiction, it's just as if there was an emptiness in them. They were isolated. They were trying to fill it with something. And I think community tends to be an antidote for that if those people can be engaged. Yeah. But there has to be a community. You know, being in the treatment field, I can tell you a lot of times the people in the treatment field, all they see is this. And it's very demoralizing if they don't feel there's anyone else. It's like, and it's that someone mentioned it, that feeling you Narcan someone and then 5 hours later they do the same thing. But what are you sending them back to? There's got to be something to send people back to where there's some knowledge and where we have a sense of what addiction really is and separate it out so that, you know, people who need help or have chronic pain or something else aren't stigmatized. And certainly the addicts aren't stigmatized. You know, if some of the stuff that we run across with addiction, if it was heart disease, or diabetes, it would never be a factor. People wouldn't be, ashamed to take a blood pressure pill,
Not even Angelo.
and not even Angelo. But I think that really what impressed me was the array of responses from people. And I really sat here thinking, I just wish there were more communities like this one. I think we'd be in much better shape with this problem.
Thank you. And our final word from Angelo?
I'll be short. President Kennedy had one of the famous quotes that in times of trouble and turbulence, knowledge is power. And I think what I've been reaffirmed today in my office is probably shaking their head like, now he's not volunteering us for more. But is that we need to continually be out in the community to provide these educational opportunities, not only for parents, but for the community in general. And just really to all come together, because together, that's how we solve this crisis.
Thank you. Let's give a round of applause to this great panel. Well, we're going to conclude tonight by, first of all, thanking each of you for you taking time to be with us tonight, for sharing your insight into this particular issue. And we know, as a result of all of your contributions, that we will make changes, we will save lives, and Robbinsville will continue to be a leader in this field. I also want to, on behalf of the Horizon Foundation and the Partnership for a Drug-Free New Jersey, thank our collaborators, the Robbinsville Community Addiction Recovery Effort, Robbinsville Township, the Mercer County Prosecutor's Office, and Prevention Coalition in Mercer County for all the work they did, in particular Jody, for bringing us together tonight. Thank you all. Please don't forget to complete your evaluation form. It should take about 2 minutes, and they'll be collecting it on the way out. Thank you.